The views and opinions of this broadcast do not reflect the views and opinions of Armed Media, New Productions, and its affiliates. Enjoy the show.
Live from Boston, Massachusetts, this is Les Skymo, unscheduled with the Dave, and we got a very special guest tonight. We have Brittany with us from the Cincinnati Eye Institute, and we're going to get into the three common types of eye surgery. She's been working there for quite a while, and she's our expert tonight on these surgeries, and we're going to get into that. But first thing I want to do is thank our troops here in America and that are spread abroad all around the world that protecting our freedoms and this great country, America. God bless them and their families, and just keep them in your prayers, folks. Dave, you got anything?
I'm just hanging out.
All right, Dave's just hanging out. Now, one reason why that I want to get into this, Dave, is because now, my mother, she's 83 years old, and she had glaucoma surgery, and she had cataract surgery at the same time on one eye. Now, I have a cataract working in my left eye, and they use the term get ripe, and now we're going to find out what that is. Now, Dave, I know you're was a medic in the Air Force, and you're familiar with some of these terms.
Some of these surgeries.
And with some of the surgeries. Now, there's actually 4 surgeries, but these are the most common. What's that other surgery?
Macular degeneration surgery.
Yeah, immaculate degeneration surgery.
Back of your eye.
And you know anything about that one, Britt?
I know a little bit about it, but not too much.
Well, all right. Well, but now the 3 main ones, and they're scary surgeries. People get anxiety before they have these done. I have a cousin that had cataracts in both eyes, and he went and had the one surgery done. Finally, when he got to where he couldn't drive, he said, well, I got to go get something done about this. Mm-hmm. So he went and had the surgery done on the one eye, and he said, man, if I knew it was that simple, I would have had it done a long time ago, and I'm sure you've heard that a lot, Brittany.
Multiple times.
And but now let's first talk about glaucoma. Now there used to be. I'm surprised at some of these dates and times when these surgeries first started happening, but we'll get back to that here in a minute. But Brittany, exactly, can you explain to us what glaucoma really is?
So glaucoma is basically when you have eye pressure that is elevated, and it gets so elevated that it damages the optic nerve in your eye, which then causes the vision loss.
Now, I don't know, I guess the proper question is what is the pressure? Where does it generate from? Do you have any idea?
So there's a natural drain in your eye that allows fluid to drain out. That drain can get blocked, and that is what causes the fluid and the eye pressure to rise. I always explained it to my patients that it was kind of like something that would be covered. If you have a tube and it is covered and there's water in it, it's just going to keep building pressure and pressure and pressure to where it will eventually...
So like a water hose.
Yeah, it will explode. Your eye is obviously not going to explode, but instead the optic nerve gets damaged. And then that is what causes your vision to lose.
Would it be kind of like putting a rubber balloon on the end of a garden hose?
Yes.
And it get bigger and bigger. And
as
as it expands, it would probably detach the optic nerve from the rear of the eye, so you'd go blind.
Yes, if you have a pipe and it, you close it off, it's just going to eventually keep building and building and building, right, where it's going to rupture.
Now, is this once that optic nerve's damaged, that's irreversible? Am I right?
Correct. There is
Right.
no fixing it.
Well, what could you explain? What type? How is this surgery? What's the procedure? What's the pre-surgery? Like, is there anything you have to do to prepare for the surgery? And then explain to us what the surgery consists of.
So typically they try to monitor your eye pressure with eye drops. To lower it, you can be on one, you can be on 5 different ones. The bad part is people typically do not know that they have glaucoma, as they call it, the thief of blindness. You typically do not have any symptoms until that drain is completely blocked off, and then you will get into severe pain. So if you go into your ophthalmologist or your optometrist and they notice that your pressure is elevated more than what it should be, that's when they have you keep coming back and monitoring the pressure. At that point, they will most likely put you on eye drops if it is not a surgical need at that time. If it is not that urgent, they typically try to start out with a laser, since it is the least invasive way. That is an in-office procedure, takes 5-10 minutes.
Yeah, I got a question. I've always heard for years that people who had glaucoma could smoke marijuana and it would lower the pressure in the eye. Is that true?
That is a big thing going on here lately, especially with it being legalized throughout multiple states. However, you would literally have to stay high 24/7 to keep the pressure down in order to keep from the optic nerve being damaged. Even so, if they did, it's still not going to reverse the damage of the optic nerve. It might keep their pressure down, but it's not going to prevent the damage.
So there's far better medical ways to keep the pressure down than smoking pot.
Yes.
Yeah. Now, you said there's a natural drain in the eye. This can't be repaired rather than the surgery. 'Cause now with Mom, we was there with her through the whole thing, and they done the flap. I don't know what they call. You can explain that. And but now where is this natural drain in your eye?
So for the flap, how they do is they go in and we call it a trap door. They basically go in, and it's kind of hard to know where it's at without showing you.
It's
on a
above the eye.
No, it's actually in the eye. So they go in and they cut it out, and they cut like a little flap, like a trap door. So they cut that open.
But it's in the top part under your eyelid.
Is that called the sclera?
Eyelid?
Yes, the sclera.
Okay, they cut. That's the white part of the eye. They cut a little trap door.
So they can open it up.
In the top.
It's kind of more towards the bottom. It depends on where
they stay away
they
from
have
the
to
cornea.
go. Yes.
Yeah. Okay. Yeah.
So they go in and they let some of that fluid drain while they're in surgery, and then they go back in and sew it shut. And they are hoping that the trapdoor will keep it flowing out, not too much. They don't want all of it to drain out, but just enough to lower the pressure.
Right. Now I know with Mom when she was real. I don't know, Nancy. Did she really go into a anxiety before she had hers?
Yeah.
And then when they done the surgery, it was minor complications, and she was on the drops, but she had to go back and they trimmed the stitches. The end of the stitches was dragging on her upper eyelid, and it caused it to bleed, and so they finally got that fixed. Just snipped the end of them off there in the facility without going over to the surgery side over there. And but now she's doing really good. 83 years old and doing real good. But now I don't know if that's a common problem. having to tweak things or not, but he said where the end of the knot was
rubbing
and he
it.
had to, and it was scraping her eyelid, and then they weaned her off the drops. They had steroid drops.
Yes.
What does them do, the steroid drops?
So it helps with inflammation. Typically, you're on an antibiotic, an anti-inflammatory, and it really just depends doctor to doctor on what they feel is best, depending on other eye issues, if they can have steroids or not. But the drops are probably one of the, if not the most important part of the surgery and how the eye actually heals.
Good. You got anything, Dave?
So I think we're pretty much exhausted glaucoma, but it's interocular pressure that causes the problem.
Yes.
So you have to, it's the vitreous humor, which is the fluid in the eye, which you have to control the pressure of to make a trap door so it can drain. It's all about pressure. You want to keep the pressure normal.
Yes.
So when you go into your eye doctor and get that little exam where you look straight ahead and a little puff of air comes into your eye, so they're measuring the interlocular pressure in your eye right there, aren't they?
Yes, and a lot of practices do not actually do the puff of air anymore. A lot of times they do what's called a tonopin. It's a little handheld instrument that kind of, it actually taps your eye and touches it, and they measure it that way. Or they do the slit lamp, which is where you put your chin in it and rest it in on there, and they bring it up, check it that way. Also, you don't feel it. You have numbing drops. You don't know.
Yeah.
Most doctors like the pressure to be roughly between 10 and 21. But again, it depends on the patient and their history. And
a doctor, I forget what his mom's doctor's name was, but he wanted to get it lower. It was, I think the last time they checked her pressure was like 15.
Yeah.
Right, Nancy? 14.
And it depends on how damaged the optic nerve is already. If there's already a lot, they obviously want to keep it down lower because it affects the peripheral vision.
Right.
So it's you barely have any central. So it's actually pretty crazy what people do see with glaucoma.
Yeah. Now, when you lose that peripheral vision, but they save your vision, that's gone forever, right?
Yes. Once it is lost, it is gone. So most of the time, or not most of the time, all the time, the surgery, I think people have the idea that it's going to bring back their vision, and it's not. Their goal is to prevent further vision loss.
Further damage. Now, this is discovered with a routine eye exam?
Yes.
Now, how often, really, and this may depend on age, I'm not sure, but how often should people get an eye exam?
At least once a year.
At least once a year, no matter what age you are?
Yes.
Yeah.
And that's another thing. People think going to the optometrist is enough. You need a dilated eye exam. Optometrists can do that, but a lot of them don't. They go in for glasses or contacts and think that is enough.
Right.
Without a dilated exam, you cannot check for the health of the eye.
Right. Now, I noticed the doctor was talking about, David, jump right in there because I'll just keep talking, so don't worry about it.
Real quick, one question. Ed, does glaucoma affect both eyes, or can it be just one eye?
It can be just one. Okay. And there's also ocular hypertension, where it's not necessarily glaucoma. You just have high eye pressure.
What's the difference?
You don't have the damage. You don't. I mean,
you
can be an ocular hypertension glaucoma suspect of where you're on the verge of it, but you can just have
that slight elevated pressure, does that give you problems with your retina, or can that cause blindness, or is it
not at that point?
Not as severe as glaucoma?
Not as severe. Yeah.
Okay.
It's just more or less needed to be monitored.
But now, can that get so high that you still have to have the glaucoma surgery?
It can.
Really? Wow. Yeah, I've never heard of that before.
I mean, most of those are just like the lasers.
Yeah.
Because they call it an acute glaucoma attack. So that's really when people know something's wrong.
Right.
Glaucoma, it's a silent disease, so you don't typically know until your pressure. We've had patients who have pressure of 60, 70, 80, and they are practically being carried in, hunched over, vomiting, severe head pain.
What are some of the things that can cause actual eye pain?
Multiple different things. You mean just glaucoma based, or?
No, I mean, say if it's not glaucoma, what if you just have a pain in your eye?
I mean, that could be as simple.
Pretty bad.
That can be as simple as dry eyes. I mean, people come in for that all the time, and they come in panicky and say,
I have dry eyes.
Yeah.
I've had for years. Years ago, I wore contacts, but I don't anymore because it's too painful. I always have to keep them wet, because my eyes are just naturally dry.
Yeah, and you get that gritty, irritated, it feels like sand.
It wasn't worth it for me.
Yeah.
Well, now what's the, is there, you normally associate these kind of things with older people. Do you ever see, is there an age where this is more common, or can anybody at any age get glaucoma?
It is possible for anyone. However, obviously younger is not as common. African Americans are more at risk for it.
Really?
Yes. And also people over 40, people over 60. I mean, if you have a family history of it, you have a higher risk.
Right. Well, and that goes with a lot of other health
that doesn't
issues.
Include us, does it?
Yeah, right. Yeah, well, it's young bucks. Now, when they do this surgery, Brittany, do they restrain your head? Walk us through that as simply as you can. When you go in there, do they numb the eye with drops? Do they restrain your head? How do they prop your eye open? How's that work?
So your head is not restrained. You are also not put under for surgery. You're typically given a peribulbar or retrobulbar block. Mm-hmm. It's basically like a short block, so it doesn't last super long.
Is that into the muscle of the eye?
Yes.
Rectus muscle?
Yes.
Is that a shot?
Yes, it's an injection.
Ooh, that sting.
But, I mean, people don't feel it. I've been in the OR where people are snoring, so people get super worked up, and
They got this like little retractor they put on your eyelids to hold your eye wide open.
They hold it open.
And they irrigate it, and they do all the work from a tiny incision.
They put drops in your eyes. I mean, you get, just like you would for any pre-op, you get your blood pressure checked. You start pre-op drops a couple of days before to prepare you to help with infection. You come in. Of course, you have to have a history and physical done before surgery to clear you.
Right.
Since you will have some sort of anesthesia. But yeah, they put a drape over your head. Your face is covered other than the eye that is being operated on.
Yeah.
But you are not restrained. You are very aware of what's going on. You might be in La La Land, but...
So that story, Lester, you told me about putting your head in a big vise and locking it down is not true.
Well, I know it is.
That, man?
I did that to my little brother one time.
He pictured this big steel vise and a big old handle on it.
I had you believing it, didn't I?
You said you get a real bad throbbing headache. And
that's the way Three Stooges did it.
Well, my sisters told me that the eye doctor was where they poked your eyeballs out and put them in a mason jar, and you got to take them home with you.
Oh, no. Hey, folks, let's see here. We got a phone call. Let's take this call. Uh-oh. Sorry about that. I missed it. I need to put my ringer on, folks.
If you just call, try it again.
Yeah, if you just called, try it again. I'm sorry. I had a meeting earlier today, and I had my phone turned down, Dave. It's sitting right there. I just didn't see it. I'm so sorry, folks. Please call back. But now, I guess you're just so afraid to move that they don't have to hold your head still. But I mean, it just seems odd to me that there's no precaution there to keep you from jerking or flinching or something.
The surgeons
like
hold you in place. They have their hands in there. And
yeah.
I know we'll get to this, but when I had my LASIK done, I was pretty nervous about.
And you work there.
I can tell you to do it all day long, but it's different for me.
Do they give you any IV sedation?
I had a Valium, and I am a very big lightweight, so I actually fell asleep.
Yeah.
I remember having surgery, local hernia surgery, and
I don't see that on the list nowhere.
This is getting back to anesthetic, though. But I slept through the whole thing.
Yeah.
Really?
And people do. I mean, like I said, they are in there snoozing away, and not a problem.
1-800-508-5431, and I'm sorry I missed your call there. I've had my phone down, and so call back. And but anyway, I hope we can help somebody. Now, Brittany, are these the pre-op and the care afterwards? Is that pretty similar with all these?
For the most
surgeries?
part, yeah.
For the most part, just slight variations.
Yeah, it might be a different class of drug, again, depending on allergies or history of if you can have the actual steroid or not.
Right.
But it's typically the same 3 ones you use.
Right. Now, I know people's not going to believe this, Dave. Okay, but me and Brittany's talking about this earlier. When did glaucoma surgery come about?
So it looks like between about the 1700s, late 1700s, a French ophthalmologist.
German. Was he French or German?
They're French.
Oh, okay.
Jacques.
Yep. Is it Davio? Davio?
DeVille? Or DeVille?
It looks like he was the first modern European physician that successfully did extract cataracts from the eye. He performed the first one extraction on April 8th of 1747. It was the first significant advance in cataract surgery since couching was invented.
Now, I have a vague memory of this surgery from years ago when I worked in the operating room. It's been 30 years ago. But what they used to do, it was when the cataract was ripe and ready to go, they had this instrument. It was called a phacoemulsifier, and they would emulsify the lens of your eye, and then they would remove it through a tiny incision.
Yes.
And then they would it was called an IOL in, which was an interocular lens, which was unfolded inside the eye and then stitched with one stitch. But now they don't even use stitches, do they?
No, they just put it right in there. They break up the cataract, and then they put in the new lens, which is an artificial lens. And there are multiple different ones. Most people get the standard lens, which corrects distance, and then you still do have to wear glasses for up close and reading. Or now there are so many different ones you can get corrected for near and far. You can get monovision, where one eye is distance, one eye is for near. Cataract surgery has come a really, really long way.
They pretty much customize your vision.
Yeah, they do.
Yeah, now that's remarkable. Back to 1700, and I told you, Dave, that's where I think pirates come from.
Could be.
Because I don't know what they would put back in there.
Maybe they
back
just recently
then,
had cataract surgery and they still have the patch on their eye. Who knows?
But it used to be an overnight procedure where they would have to stay in the hospital, and now it is roughly a 10-minute procedure, and you're in and out of there.
Well, now, once you have the cataracts, or folks are on cataracts now, we're moving along. Now, like I say, I've got a cataract. Mom had cataract and the glaucoma at the same time on the same eye, and it went great. She's 83 years old. If it's not small, very small print, she don't need her glasses.
Right.
And she drives, and now the daylight still kind of irritates her eyes, a little bright still, but that'll calm down. It takes several months for everything to make the adjustment. But now, what is the progression of cataracts? What do they do to the eyes? Can they cause blindness? How do you know? Now, I know I started getting something. I knew something was wrong with my eyes, started getting blurry. Then I got an eye exam, and then he found that. Now, what's the term ripe? I mean, what does that mean when it's dealing with cataracts?
Basically, it just means at what level is the cataract. So the beginning level, it's developing, but it's nothing that needs to be operated on, quickly. The first kind of quick signs are hazy vision, blurred vision, trouble reading street signs, trouble in dim light, halos around lights, or like sunburst where they kind of go out. Those are the first early signs.
Night driving.
Yeah,
that's a big one for me. Yeah, them oncoming cars put my eyes out. Now, if you got a cataract in one eye, does that mean sooner or later I'm going to get one in the other eye, or who knows?
So every single person develops cataracts.
It
depends on how you take it. You can be 50 and not see because of how bad your cataract is, or you can be 95 and the cataract not bother you and you don't want surgery. It's just the ability of how much it hinders your daily activities.
I got a question about eye color. Does eye color make any difference as far as developing cataracts?
No,
There's many
not to my knowledge.
Blue-eyed people get them as often as brown-eyed people?
Yeah, I think it's all the same.
I
haven't heard of eye color affecting it.
Right. Now, once I have another lens, or anybody, when they put that new lens in there, can they ever get cataracts again in that?
So it's not another cataract, but there is something called a secondary cataract, so people call it. It's basically just where it kind of clouds back up, and all you do is go in the office and get a 5-minute laser procedure. You don't have to go through surgery again. You just get it zapped out.
Right now. Well, that's good to know. Yeah, and but you say the procedure's pretty much the same surgical procedure, right?
As the original cataract surgery?
Well, I mean, it's no than the glaucoma. The time now, how long is it? Let me ask you this: is it as quick as the glaucoma surgery?
Glaucoma, if you have a laser procedure for glaucoma, it can take 5 minutes. If you have a surgery in the operation room, it can be a half hour. It can be 90 minutes. Mm-hmm. It really just depends. There are so many different glaucoma surgeries out there. It depends on how bad.
I think mom's about 30, 40 minutes, Nancy.
A trabeculectomy averages about 45 minutes.
A what?
It's called a trabeculectomy.
Say that 10 times real
fast. Yeah. Okay, now with the cataracts, once you had that surgery, you're good. What would you say to somebody? Because that's one of the most common, I think, is cataract. What would you say to somebody that's facing that and they're really, really scared about it?
I see patients quite often come in. I actually had a lady I know come in, and she about passed out in the waiting room because she was so nervous from it. I kept trying to tell her to calm down and it would be okay. But any surgery is nerve-wracking.
Oh, yeah.
Just like I said, I can tell you to do it all day, but when I actually got in there, I was about to puke.
It's far better than a root canal, though, wasn't it?
Oh, yeah. Yeah. So, I mean, it's your eyes. It's a scary thing. Right. Nothing coming towards your eye is a comforting feeling.
Right.
But we eventually got her back there, and she got calmed down. And then her second eye, 2 weeks later, she practically came in skipping down the hallway. And I said, see, it was no big deal. And she was like, oh, I know. So,
but everything's corrected, though. Unlike the glaucoma, where it leaves damage if it's gone, let go a little while. Yeah. The cataract surgery, it's corrective.
And that's what people don't understand is cataract is an elective surgery, meaning you don't have to have it done. It is not going to hurt your health. it is going to hinder your vision and make it very difficult for you to see, but it is not damaging to you. It's not going to hurt you.
Ripe when you can't see, can you?
Right. And sometimes a cataract can be so dense that they struggle going in there
to
get it. Yeah.
The image.
Yeah.
Right. Now, is that when you see these old dogs, and I guess a person's eye would be the same way. If you never do nothing, it'll turn white.
See the white.
Yeah, now that means you see nothing or just daylight and dark?
It's just how dense that cataract is. It's how clouded that lens is. Yeah. And when you say ripe, since it is an elective surgery, you have to meet certain requirements in order for insurance to pay it. And insurance only is going to cover a standard lens. They aren't going to cover all of the extra ones that we now offer.
Right, yeah, that's normally, anything fancy, they won't,
Let's look at it this way. If, say, you had a pair of binoculars and you were looking at something and then you took Vaseline and you put it over the lens, you wouldn't be able to see anything.
Right.
So that's exactly what's going to happen.
Yeah.
The lens of your eye focuses the image back on the retina.
Right.
So if the lens is bad and cloudy,
it's not going to be clear.
You can't see anything.
Right.
Yeah. Folks, I told you, Dave knows a little bit about this. And, but this, this is a big deal to me because, sooner or later, Brittany, I'll be over there to see you and get this took care of.
Well, they won't put that ice pick in your eye like they did.
Well, I want a patch, whether it's successful or not. I still want
You'll
a
get
patch.
a patch.
I'm going to get me a seeing eye parrot.
You going to cut one of your legs off and get a wooden leg too?
Nah, just wear a wooden shoe. But now, these, this is, this is really taking off, this kind of surgery these days. And is it just old age and natural? Is cataracts just a natural?
Yeah. It's just a natural clouding of your lens.
Just like glaucoma. Is there somebody, back to glaucoma for a second, is there somebody that is a better candidate to get glaucoma, or is it just the luck of the draw?
It's kind of just the luck of the draw. I mean, like I said, African Americans are at higher risk.
Yeah.
I don't really know the reasoning behind that. And, of course, the older of age.
I've always been told, I've worn glasses all my life practically, and they say that these glasses that I have filter out UV. And they say that UV causes cataracts. Is that true?
Not to my knowledge. They could.
Because I've always been told, they say, well, you want the UV filter on your lenses because if you don't have the UV filter, you can develop cataracts from being out in the sun.
The sun can definitely do some damage. Can scar your eyes. It can do multiple different things, but I don't believe it would form a cataract.
I've heard theories on it, and they said the theories I've heard were that cataracts are formed in a way as a protective means to protect the eye, that it clouds up because of the constant exposure to light, bright sunlight, that's the reason it happens. But that's not fact, but
that may just be a theory.
It could be a theory.
Yeah.
But
plus they want to sell
I've been told that for years.
Eyeglasses.
They say, oh yeah, you got to have ultraviolet protection because you go out in the sun, it preserves your eyes and you won't get cataracts.
They also, there have been multiple commercials out for vitamins or some sort of pill that can prevent cataracts from happening, and
gimmick.
That's not true.
Gimmick, like fishing and playing golf.
Eat a lot of carrots.
Yeah, you never seen a rabbit with glasses.
Eat so many carrots you can see in the dark.
Mm-hmm.
Now, before we get into the LASIK, Brittany, how did you go from being a beautician to getting into the eyeball business?
So I had been doing hair for, probably 5 years. And then I found out I was having my first baby and figured out that I needed to have benefits and, good things for my family and not work every day off of tips and commission.
Right. Yeah.
My cousin actually worked for an ophthalmology practice and they were hiring, so she got me in. Had an interview, got hired as a tech that knew absolutely nothing and was freaked out by eyeballs. And I remember we had a patient who actually had a glass eye, and I think it was my first week. He popped it out and said, "I need this cleaned."
Did he go,
Did you stick it in your mouth and swish your tongue out? And go,
I think I turned white.
oh, my goodness.
But yeah, so she got me in the door.
Clean them, isn't it?
Yeah,
Yeah,
just
no.
blow
They-
on
I feel like taking
it.
a stick in-
They do get polished. But yeah, so I learned hands-on. I learned by all the techs and the doctors.
Was it a blue eye or a brown eye or a green eye?
I don't even know. I was white.
You know,
That's all I know.
That's important. That's important to know. We need to know this.
Yeah.
Yeah.
But after 2 years of being there, I got promoted to the lead tech for a pediatric doctor there. And then after a while, I got offered a bigger job at Cincinnati Eye as the surgical coordinator for a glaucoma and cataract surgeon. So I would counsel the patients and make sure that all of his OR surgery days ran smoothly, and I had to order donor eyes and pretty much counsel the patients and listen to them cry in my office.
Yeah.
So
And,
did you order the actual for cornea transplants?
Yes.
Okay.
and
so,
tissue patch grafts and
So
yeah.
they still do that?
Yes.
Okay.
Yep.
They don't have any way to artificially put a cornea on.
No.
It has to be
Nope,
natural.
it's fresh. Yep. And we get it from
cadaver.
the Cincinnati Eye Bank.
Yeah.
Yep.
Yeah,
Ship it over.
donors.
So
Yeah.
people sign the card. They want to
Yeah.
be a donor. So
Yep.
they zap their cornea off and
Yep. Got their eye.
put it in a
Yep.
Playmate frozen bag and take it over to
Ship it over.
Ship it over.
Yep.
How long do they last after they're donated?
It depends on what temperature they're kept in and all of that. It's all depending on if it's in a freezer or if it's in a refrigerator. It can be, I think they recently changed it to, I'm no longer in this position now, so I think they changed it to 2 years now where it was 1 year.
Yeah, I never thought about that surgery. Now, a cornea replacement. Now, why
Yeah.
would you have your cornea replaced?
Damage.
Now, how would
Damage.
it, like, now from something sticking in your eye?
Yeah,
or-
there can be multiple different things. You can, wearing contacts and sleeping in them and
I've heard of people getting
Yeah.
them stuck in their eye
Yep.
and damage your
Or
eye.
you run in a
getting it
lathe or
out
a
of
machine and a piece of metal comes
Yeah.
out and punctures
Yeah.
your eye and
Yep.
destroys. You get an infection and destroys
chemical
your cornea.
burns,
Oh, yeah,
Yeah.
lots of things.
multiple
it. So
different
they
things.
can restore your vision with donors' cornea.
Help repair the damage.
Back when I was
Pretty
at work,
awesome.
I'm retired now, but back when I did work, you were forbidden to go out on the floor without your safety glasses on.
Yeah.
And they would nail you, and they would write you up. They catch you doing that, they'd get you fired.
I don't think people truly understand the damage. I have never been terrified of fireworks until I got into ophthalmology, and
Oh,
it's one of our busiest holidays to be
Right.
on
Is
call.
that right? Yeah.
I think
Yeah.
last year my doctor had like 200 calls on
Oh,
4th
my.
of July for eyes
Really?
being
From
blown out.
fireworks?
Yeah,
Is that right? Wow.
yeah. People take it for granted.
Yeah. Well, we're taught when we're little kids, protect your eyes, you only got two of them, that'll put your eye out. We've all heard that.
I'll tell you
know?
what, if you're going to mess with fireworks, dress like a welder.
Yeah.
Because
Yeah.
you wear the welding mask, the gloves, all the protection and everything. Then you can mess with them because you're protected.
Yeah.
I
Unless
mean-
it's dynamite, and that's a whole nother
Yeah.
story. But
You
That's,
can
that will protect you if
Yeah.
you have a welding outfit.
yeah.
you can get metal in your eye and then it turns into rust. You
Yeah,
have a rust ring in
right.
your eye. We've seen sticks in the eye. We had a little boy last year that got shot in the eye with a BB gun by his brother.
Could you say
So I left that day, so I'm not sure. It
Yeah.
wasn't my department, but
Yeah. Was it hard for you? Was that a tough transition for you when you first got into that? Was you? I know you was probably really nervous about it.
it was because of that. Plus, I was pregnant, so
Yeah.
everything made me sick.
Oh yeah.
I mean, we even at my old practice, we did chalazion removals, which is basically like a sty on your eye.
Mm-hmm.
And my very first one, I did pass out because it
Oh,
it popped so much.
Oh,
I was
my.
Was it a
disgusted
big
by
one?
it. Yeah, and now I want to be the one popping it.
Yeah. Well, now let me ask you this. Now,
The eyelid's so thin though.
Yeah.
It's so hard to do. You just
Yeah.
barely cut it and
Yeah,
pop
they
it
flip
out.
it
Yeah.
over and go
You gotta
in.
get the capsule that it's in.
yeah.
Or-
Now,
or
you
pop
never
it
had to
back.
go to college or go
No.
take a bunch of schooling or anything for this.
No, they do like you. You can get certified. So as long as you're under certain education, we offer tons and tons of education classes through work. We actually have a dissection class where we either get a pig eye or a cow eye,
Right.
and we'll dissect it and look at the optic nerve and everything in there,
Right.
so we can see what's going on. So
Right.
every year you can get certified for something else. So yeah, it's
Well,
pretty cool.
and I'll tell you why I asked that, Brittany, because I don't know who's listening to this show out there or on Facebook, but there's opportunity out there to do something that is really good profession.
Yes.
And one good thing about it, my dad always told me, he said, if you get into a trade, he said, son, get into something that people's going to always need. So I've become a mechanic. But there's opportunity out there without going and getting bilked for
Tons of
thousands of
loans.
dollars, sitting in a classroom getting brainwashed by some college professor. Now you've got two professions. You can always make a buck on your hairdressing. Now you had to go to beautician school for that, but that was 9 months, 8 months. Something
I
like
did mine through high school. So
well,
You could only find people with hairy eyes.
yeah, there you go.
That would be perfect. You could do the
I don't know about that one.
Your eye, maybe put a couple.
There you go, or at least bushy eyebrows. But my point is, there's
Yeah.
for these young people, explore your options, Dave, because there's opportunity out there. You just got to have enough courage to dive into it and enough gumption to get out there and get her done. There's things out there, professions out there where you don't need 4 years of college. Let's face it, Dave, everybody ain't cracked up for
I just
college.
thought of a question. Are you've heard of cochlear implants for the ear?
Yes.
Do they have an implant for your eye where you can see anything? Can they do an interface between an optical sending unit and the optic nerve? Can they do anything like that?
I have no
Or is this
idea.
science fiction?
Bionic eye.
I don't know.
They're probably somebody's working on it.
I
You
did
can
see a
bet.
story about a year or so ago where they actually did do that. They had this little lens that they implanted on this guy's eyeball, and it somehow interfaced with his optic nerve, and he could actually see out of it. Now the vision wasn't very good,
Yeah.
but he could actually see out
I
of
think
it.
I seen that and it worked. But if you have any optical damage nerve, it won't. There's no success.
I believe it. I mean, the stuff that the surgeons do at my office, we have over 60 surgeons, and we seriously have people that come from Africa and all around the country just to see our surgeons. I mean, they really
yeah.
are the best of the best.
Cincinnati Eye Institute's got a world-renowned reputation for the work they do,
Yeah.
and it's amazing. But, I just thank God they give people an opportunity like you.
Yeah.
They give people opportunity to come in and be a professional. And you've worked in several departments. You advanced pretty fast in the place. And no doubt it's because you wanted to learn and you had the drive to do it. And you was motivated. You was a young family. And that motivated you, hey, I got to do better here. But that's it should be an inspiration to other young people that, hey, it's there, you just got to go
Speaking
get
of
it.
young people, do you all do surgery for cross-eyed kids? On cross-eyed kids?
We do not at ours. We don't typically do kids at all. We send them to children's or somewhere else.
Right. Yeah, that's probably a very extensive
Yeah.
It
deal
seems pretty
right
easy.
there.
I don't know. I've never seen it, but I always thought, that's a
There's a lot to the eye muscles.
yeah, but that's a neat way of
That's where
fixing it. Though is to actually operate to where you don't have to. I mean, you think that couldn't be fixed, but it can be.
By a certain age.
But you guys don't do kids.
No, I think our cutoff is 12 or 13. We start seeing them.
Now, let's get into this LASIK surgery that you had.
Okay.
What is LASIK surgery and what's the benefits of it?
So it is a corrective surgery. So obviously it keeps you from having to wear glasses or contacts, depending on what your prescription is. You have to be a candidate for it. So your cornea has to be a certain thickness. Your eye has to be healthy. Glaucoma, they don't recommend it because the surgery itself can elevate the pressure.
Right.
So it can help nearsightedness and farsightedness, and just overall to improve your vision.
Right. Now, if I've had cataract surgery, then I'll never have no need for LASIK, right?
There are different types of LASIK, but typically you're not going to have cataract surgery before you have LASIK. Right now, it's come a long way for cataract surgery, but LASIK can have not the best outcome for cataract surgery, depending on measurements and everything else. Obviously, in 10 years, it's been a complete change of how far they've come. So I expect in 10 more years, I was kind of wary about getting mine just because I debated with myself, do I want to see now or would I rather see better when I'm older and have cataract surgery? I simply chose now just because of my kids and because I figured with technology the way it is, it's probably not even going to be an issue 40 years from now.
Let me ask this question. Now, cataract surgery is dealing with the lens of the eye. LASIK surgery is dealing with the cornea. So they're two different things.
Right. But it's just all measurements.
Right. Now, the correction Les is talking about, if he has cataract surgery, if his cornea is fine, he's going to be able to see great, right? He wouldn't need any LASIKs, would he?
It just depends, honestly. I mean,
you can see far away, can't you?
Yeah.
It's just the near vision, or you can see far.
Yeah,
just the near vision that's bothering
my near vision shot.
You wouldn't be a LASIK candidate then.
Oh, really? Oh, okay. Now, you're saying you chose to do it, have better vision young. Does that mean that cataract surgery won't do you any good if you develop cataracts?
No, you can still get it. It's just your vision may not turn out as crisp as what it would if you just had the cataract surgery alone and didn't have previous LASIK.
All right. Now, your eyes, you felt were that bad to have the LASIK?
Yes.
You're extremely nearsighted?
So, yeah. I could not even see the big E on the eye chart.
Oh, my, really?
Yeah, so my vision was 2400. So
mine's about 22, I think.
Yeah, so I was legally blind. The biggest thing for me was I hated wearing glasses. Yeah. I'm super sensitive around my head, so the glasses would give me headaches. Mm-hmm. But then if I didn't wear them, I would have just as bad of a headache.
Right.
And then the contacts, I was horrible about taking them out. So I would sleep in them, which is huge. And I would get lectured every day by my doctor for it. But I was worried that if my kids got up in the middle of the night and I didn't have my contacts in and couldn't see, and what if I couldn't find my glasses, I'd probably run into a freaking wall and not find my kids.
So I'm sorry, go ahead.
Oh, you're okay.
The LASIK surgery all boils down basically to what you want for quality of life.
Yes.
Is that what Mm-hmm. And, but now, in all three of these different surgeries, and take them one at a time for me, what's the risk factor of negative outcome with each surgery, or is there a risk factor at all?
I mean, it's pretty much the same as every surgery. You have the risk of bleeding, infection, complete vision loss.
That's why they do one eye at a time.
Yes, and they always do your worst eye first and keep your dominant eye. So that way, if, God forbid, something happened to your bad eye, at least you still have your good eye.
Good.
People fight that quite a bit of, well, why can't I just have both eyes done?
Cochlear surgery too.
at the same time, and it's for a reason.
Yeah, I didn't know that, so that's
yeah, that's the reason why. And most surgeries, glaucoma can vary. LASIK they do at the same time. I had both of my eyes done at the exact same time. It was a 10-minute procedure. I was there for maybe an hour, and I went home.
So this is basically in LASIK surgery. They're going to numb your eye. They're going to have you. They're going to probably put some kind of retractor in it to keep it open. They're going to moisten it, and they're going to take and have you stare at something, and they're going to actually, with a computer, change the contour of your cornea so that you will have 20/20 vision.
Yep. And that's the goal, at least.
That's fairly straightforward.
Yeah, it's pretty easy. I will say when they hold your eye open, I think that's what I was so nervous about, was looking in the wrong place. But I was so knocked out from that Valium.
Yeah.
I think that's what I was most nervous about.
Right.
But it's not painful. It was just the pressure of them inserting that and holding your eye open.
Right.
But let's see, I'm going on almost 2 months of having mine done, and I have not had one day of pain or bad vision or any issue at all with mine.
Now that's probably the case on average with most people, I'd say.
Yeah, most people get up and can see.
Yeah.
I remember
as soon as
when
they get up.
corrective surgery first started with the eyes. I thought about having it done, but I'm glad I didn't. But what they used to do was called a radial keratotomy. They took and they made slices in the cornea.
Yeah, like pie.
Yeah, they made cuts in it, and with a scalpel, and it changed conformed the cornea to a more perfect shape. If you've got a flat cornea, you're going to be nearsighted.
Right.
So they actually could cause it to change, but it wasn't that accurate. I mean, they could do it, but it really wasn't that accurate. And plus, you could get scarring for them on the cuts.
Yeah.
So this is much better surgery than the radial keratotomy.
Yeah, I mean, they literally held the machine over my eye and lasered it and just kept saying, look at the red light. Don't move your eye. And that's all it was.
Yeah.
I mean, there was no cutting. There's no nothing.
It's amazing, this technology.
It's mapped out, planned out, and they just do it. I mean,
Yeah.
they just take it, make it, and plane it down to the perfect shape.
Yeah. Now, who was this German surgeon? Tell me something about him, Brittany, and give me the date, if you have it, when he started. Now, this guy, he invented the knife for the cataract surgery. But now tell us a little bit about him. He's a German guy.
So, I think I'm saying this right, but Von Groff?
Von Groff.
Sounds good to me. We'll go with it.
All right. So he was considered being one of the most important figures in the 19th century of ophthalmology.
1800s.
Yes.
Oh, my.
So for his achievements, there was a method of treating glaucoma and a new operation for cataract surgeries. He introduced the iridectomy for glaucoma, which is basically putting a surgical hole in there for the glaucoma to release that. He described the combination of retinitis pigmentosa and perceptive deafness in Usher's syndrome. He also provided early descriptions of optic neuritis and chronic progressive external, correct me again if I'm wrong, but ophthalmalacia?
Sounds good.
Okay.
Yeah. Now, what year did he start doing his surgery? Now, this was in Berlin, right, Germany? And
this was 1868.
1868, they're doing glaucoma surgery.
Yep.
Man alive, that's unbelievable. That they knew what they was dealing with. How did they know I wonder what they was dealing with back in them days.
I guess just being really smart.
Man, I guess, yeah, there's people, and people lay still let you do that.
What I'm wondering though is
Yeah.
how in the world, if they were doing this for glaucoma, right? If they were doing surgery for that, how'd they measure the pressure in the eye? How'd they even know to do it?
I
don't
have
know.
no idea.
'Cause
It's amazing what they come
They
up
drain
with.
a
That's
little
not
bit
an
out.
easy thing to do.
Right.
Well, they probably from cadavers knew how much from biopsies, dissections. They knew how much fluid should have been in the eye.
Well, you can feel, whether an eye is hard or soft of pressure too. I mean, I wouldn't be able to touch an eye and tell you exactly what the pressure is, but there are ways to tell by the feeling of it.
And I guess it just
I don't know. I've always had those little bursts of air. That's how they go.
yeah.
I'm an old guy, so I remember back when that first started.
Oh yeah, you'd flinch every time they do that.
Oh,
Yeah.
puff right in your eye.
Yeah.
You know it's coming, so
Yeah.
it freaks you out.
Well, Brittany, I appreciate you coming and doing this interview, and I've learned a lot, Dave. And
How much time we got?
we got 2 or 3 minutes.
Let me
probably.
read something real quick. This is dealing with not necessarily eyes, but it's talking about blindness.
Keep it short.
Okay, and Jesus said to them, "You have both seen him, and it is he who talks with you." This is the man he cured of blindness. He's looking for the Messiah. It says, "For judgment I have come into the world, that those who do not see may see, and those who see may be made blind." And some of the Pharisees heard this, and they said, "Are we blind too?" And Jesus said to them, this is interesting what he said. He goes, "If you were blind, you would have no sin. But now you say, 'We see,' therefore your sin remains." So what he's talking about is people seen the miracles, Jesus healing the blind
1
people.
minute, Dave.
But what actually, they didn't believe it. They saw it, but they didn't believe it. So if they hadn't seen it, they would have a reason for their sin. They'd say, "Well, we didn't see anything," but they did see it.
Right. Yeah.
That's the important thing.
Well,
They
you
did
can
see
have perfect vision and not see.
it. Yeah, oh,
Yeah.
exactly.
And hey, we're down, Dave, to about 40 seconds. Brittany, thank you so much.
Thank you.
I appreciate
It was
that.
very educational.
And you become a brain surgeon, we'll have you back.
I think we all learned something.
But folks, I hope we helped somebody out there. And we didn't get a lot of phone calls or a lot of questions, but
Hopefully it wasn't the blind leading the blind.
yeah. So, but anyway, folks, thank you so much. You on Facebook.
Revolution.
All right, Dave, tell them bye.
Shooting rockets to the moon.
All right, it's less Skymo, same time, same channel, next week, unscheduled. God bless you. Thank you.